Hello, and welcome to our webinar series showcasing the outstanding work of community agencies across New York State funded by the New York tax checkoff dollars to reduce mental health stigma. I'm David Minot, Executive Director of Mental Health News Education, publisher of Behavioral Health News and Autism Spectrum News. I'm honored to have the opportunity to highlight these impactful projects and share with you the details of this important stigma reduction work. This series of webinars aims to highlight the innovative efforts of 7 organizations funded by the New York State Office of Mental Health for Stigma Reduction Community Initiatives in 2022 and 2023. We'll learn how these agencies identified targeted audiences within their regions, tailored their engagement strategies, and chose their interventions to address specific types of stigma impacting their communities. Stigma remains a significant barrier, discouraging individuals from seeking mental health support and limiting opportunities for those experiencing these challenges. However, local community providers possess invaluable knowledge about the populations they serve, positioning them uniquely to develop the most effective anti-stigma interventions through tailored outreach, marketing, education, and contact-based efforts. Over the course of these 7 webinars, we'll dive deep into the real-world experiences of these agencies to explore their methodologies, the challenges they faced, and how they measured the impacts of their interventions. Their stories offer a wealth of insights for other organizations looking to implement successful stigma reduction initiatives in their communities. We will also examine the key elements essential to any stigma reduction project, including understanding the target audiences, defining engagement strategies, setting clear goals and deliverables, and developing mechanisms to evaluate both qualitative and quantitative outcomes. Ultimately, these webinars aim to stimulate broader interest and collaboration in the fight against mental health stigma and increase mental wellness across New York State and beyond. We will include contact information at the end and encourage you to reach out to today's speakers to discuss how you can replicate a similar project in your own community. By fostering community coalitions, we can amplify our collective efforts and drive meaningful change. Once again, thank you for joining us and enjoy today's presentation.
Hello, my name is Melissa Weddingle. I'm the Chief Executive Officer at Hands Across Long Island, or HALI. We're a nonprofit supporting people who struggle with mental health and co-occurring challenges down here on Long Island. We primarily serve Nassau and Suffolk counties, a little bit in Midtown Manhattan and north of the city as well. We offer housing, supports for people who don't have housing, bridging from prisons and hospitals, and some wellness coaching, particularly around physical health and employment supports. And my background is in public health and peer services. So I myself am a person with lived experience and have a few decades of up and down and recovery under my belt. And for us here at HALI, stigma is personal. We address public stigma every day by virtue of who we are. We all have some form of lived experience here, and that informs really everything that we do. We address structural stigma, or the pretty severe disparities that our community experiences by virtue of what we do. So our services address really all of those disparities. Isolation, we have a lot of social events at our recovery center. Homelessness, our community experiences higher levels of homelessness. We provide not only housing, but outreach for people who do not have a place to live. Our community experiences higher rates of incarceration, and we support people in prisons and jails and help them bridge back to the community. Higher rates of unemployment, and we support people who are trying to get back into the workforce. There's another disparity that's really important to us as well, and that's around our physical wellness. So our community experiences higher rates of physical illnesses, things like diabetes, COPD, heart disease, and there's a as a direct result, our community is dying 25 years earlier than the rest of the population. And the causal factors there are complicated, but I want to talk about them a little bit. So the causal factors for our community experiencing higher rates of physical illness include, sure, lifestyle, diet, exercise, smoking, just like anybody else. And we're working on these things just like anybody else. There's another one that people don't talk about quite as much. It's really a structural stigma all unto itself, that there are certain psychiatric medications that have detrimental side effects that affect our physical health. That is not the focus of this particular project. There's another documented causal factor for high rates of chronic disease in people with certain psychiatric diagnoses, and that's stigma within the healthcare system itself. So if we take a look at how on earth would that happen? What are the mechanisms? It's really kind of simple. The doctor-patient communication challenges can really challenge the therapeutic relationship. Many people in our community talk about sort of an overemphasis of stability over wellness. Like when they see their medical doctor, many of the questions just seem to be around, just take your medication, and that's all we really want to talk about with you. There's another one that's really quite serious. It's this phenomenon that came up in the research for us called diagnostic overshadowing, where people who have physical health symptoms, those symptoms are overlooked and attributed more to them having some kind of mental health diagnosis. And the other thing that can happen is that people kind of get sick of being ignored or treated a certain way when they get medical care, and then they avoid going to the doctor. And we know with primary and preventative care, that can really affect our health and wellness in a significant way. So it's troubling to hear about stigma in the healthcare system, but to us, it was also good news, because we know through all the work on stigma that's been done that it's workable, right? If we think about the work of Patrick Corrigan, especially, we know that contact-based interventions, which are education, exposure, connection with people who have lived experience, we know that that works, and it's actually very effective in combating stigma. So thus our project, Overshadowed, Stories of Stigma in the Physical Healthcare System, was born. We had this idea that we wanted to talk to people and find out more about their experiences in the healthcare system, and then share that, see if doctors and medical staff might want to hear about that and share that with people. So our project had three parts. First, we went out and spoke to as many people as we could who identified as having psychiatric diagnoses, and we talked to them about their medical care. This was not a scientific study. This was not a randomized study of any sort. It really was just, let's talk to as many people as we can, snowball sampling, you might call it. And we did focus groups at PROS programs, community residences, and here at our own recovery center as well. The second phase was out of that group, we got, out of that group of 45 people that we spoke to, we got 8 people who really had something to say and wanted to share their experiences on camera. And the third part was we partnered with some medical groups who wanted to hear what we had to say. So we went and presented there. And for each of those 3 phases, we really learned something. So I'm excited to have the chance to share what we learned. So first, with the focus groups and interviews that we did, we really weren't sure what experiences people were going to report. And we made sure that we didn't ask any leading questions. Just tell us about your experiences with medical care. Because really from the beginning, the purpose of this project was not to villainize medical staff. We wanted to just start a dialogue. So the good news is lots of people have great relationships with their medical doctors on Long Island. We have a great network of federally qualified health centers and clinics and places where people can go if they're willing. So that's the good news. We also had some people who shared some slightly more concerning experiences, some to the point that they had sworn off doctors altogether. And I just want to share a couple quotes that came out of that process. I don't want to tell my doctor about my mental health because she will be scared of me. So this feeling that we have that we don't want to scare people, knowing, we understand how they might be looking at psychiatric diagnoses. It makes me upset when they repeatedly ask if I am on drugs or what medications I am on. It's really not difficult for us to, anytime our community has conversations, how frequently, and I personally have experienced this, when a doctor will say, "Did you take your medication today?" I had a dentist ask me that once. Two more. I feel nervous and like they are hurting me with all the medicine. Not everything is explained to me. We got that a lot where people didn't understand what was happening and needed a little bit more time. I mean, health literacy, that's not unique to people with psychiatric diagnoses, but it might be something for doctors to really think about. And the last one, when you tell them about your mental illness, just like everyone else, they don't understand. He feels like, meaning his doctor, he feels like it is impossible to hear or see hallucinations. He is a great doctor, but he just doesn't understand. So that idea that your inner experience, you really can't share what's going on with someone who's providing care that's quite intimate to you. So that bridging that experience, that psychiatric experience with physical health care, how important that is, that's what we're trying to get across. 8 people out of those 45, as I said, agreed to speak to us on camera. And this is where it started to get exciting for us. We partnered with Lucy Weiner of Wildlight Productions. You may be familiar with her work. She's an award-winning documentary filmmaker. Includes Unlocked. Her work includes Unlocked, Kings Park, Stories from an American Mental Institution. And Lucy actually gathered the original crew from the Kings Park film, came out to Long Island and our recovery center and shot the footage. We had a filming day. And that was really exciting to work together because she really, she's part of our community. She gets our community, and people felt really comfortable speaking with her. And the experiences that people shared, they really ranged from what we would call microaggressions, just things that were said that were really surprising, particularly coming from medical staff. And some of it really was more serious. I did not think that phenomenon of diagnostic overshadowing would be represented in our community, especially since we weren't looking very hard for it. And it was surprising how easily we found it.
In my opinion, I definitely think there is such a thing as mental health stigma. Some people, when they learn that you deal with depression or anxiety, they can kind of look at you differently. But sometimes I think it makes people connect better.
I truly believe that having a psychiatric disability in seeking really good, positive medical attention, there's just a barrier, and you don't receive the same care.
My rights to have been sometimes abused or neglected or not considered at all. when I ask for an explanation of whether it be a diagnosis of whatever kind of doctor that I'm seeing, that I feel as though that I'm entitled to an explanation. It seems like people think that they don't have either the time or I'm not worth the time. I feel rejected. I feel less than. I feel like that I'm different.
It's almost like people look at you like you are a problem because you're not behaving in a way that they want you to behave. And they think that you can just like snap a finger and magically feel better, act better, and be this mold that they want you to be. It's disappointing. And I don't know how to change it, other than how can we infuse some more compassion into these areas?
Which is the reason why this topic is so necessary, because this is the barrier. This is truly the barrier, the stigma that each one of us walks with, and especially for those who think that they walk with none, because we all do have it, and if we can really focus hard enough and deep enough and eliminate that, wow. Wow.
When I have to go see a new doctor, I get very anxious because I feel like I need to explain myself when I have to write down all my medications and what they're for. And sometimes, it happens where people raise an eyebrow when they read the list. I feel very anxious and like I'm almost being judged sometimes. I feel less than when I have to explain all these things, like something was really wrong with me that I bring upon myself.
I felt like they just had this image of me and that's all they were going to do. And it hurt. It hurt a lot because I've worked so hard and come so far, and they didn't respect that, as a human being or even somebody that's had difficulties and is doing better.
There was a time period when feeling disrespected, ignored, not getting the care that I felt I needed, or even being able to explain what I thought I needed. And so I just stopped going to the doctors.
Some doctors might not even want to work with you. Some primary care doctors who have no experience with mental health, they might be afraid and have a lot of judgment, get you in and out if they even take you. A lot of times they tell you they're not taking on new clients, which is a nice way of saying, no way.
I think the stereotypes vary based on kind of what mental health issue you have. Maybe if someone's super depressed and can't move, can't make food for themselves, people might just think that they're lazy. If someone with anxiety is having a panic attack and crying or whatever, people might just think, oh, they're being overdramatic. That's not how you should react to that situation, but they really do feel that way.
For a while, trying to make the decision just to go to the ER was difficult, knowing what I would walk into. And so eventually knowing, okay, you're going to go there, you're going to have to fight with them for what you need. The fight was greater than the risk of just not going. And so I chose not to go. I would suffer at home with the asthma attacks, knowing, okay, this is my last vial for the machine, but I'm not going.
So I'm often like, okay, if I go to the doctor or to the emergency room, are they going to listen to me, or are they just going to be like, oh, it's all in Angel's head, like this is something she's making up, or it doesn't fit the textbook, so yeah, it's just something in her head. These are all the things that go through my mind whenever I have to go and receive medical treatment, especially if it's not a planned appointment. Like if I have to go to the emergency room or urgent care, my thought always is, what's going before me? Is it going to be my mental health diagnosis? Are they going to treat my medical condition, which is why I'm going there? Or are they automatically going to be like, it's in her head, like, turn her away?
How do I tell you? You're not doing your job. You already see me as a problem. It was very scary to try and tell them what I needed, because they see themselves as knowing better than you do. And I trusted that, okay, well, they're supposed to, so I'm supposed to keep my mouth shut. I'm not supposed to say that because it's not what they think.
So that's an example of one of the film clips that we ultimately shared with groups of medical staff. And I will say the people that were in the videos, their favorite part probably was when they got to give advice to medical doctors. And we have to really thank the groups of doctors who allowed us to come share the films with them, because we know that doctors' time is not cheap. So I just have to mention Sun River Health and Harmony Healthcare and Charles Evans Center here on Long Island. Those are three of our really great federally qualified health centers, and they were a great place to start with this project because they provide integrated care to underserved communities. So some of the people we were speaking to actually got their care at those centers, which was interesting. So I think the response that we got was, we really couldn't have asked for a better response. I think they too were happy that they weren't being villainized, that it created more of a dialogue. We got some really great feedback on different directions that we could go in. One of the doctors, for example, talked about how they completely understood that everyone in the videos, for example, was talking about needing more time with their doctor, and that they basically they wanted a more person-centered experience. And one of the doctors said, well, we get it, and that's great, but how do we do that in a 15-minute appointment? You know, in other words, it's more complicated than just the patient-doctor relationship. There are billing requirements and all of that. So that started an interesting dialogue. And the biggest recommendation we got from the federally qualified health centers was that the best audience for these videos would be hospitals and medical students. So we haven't gotten into hospitals really yet, but we did have a really wonderful opportunity to present Overshadowed to a group of medical students at Hofstra University. And that was really incredible. We got some great feedback from them about getting this perspective when they were first starting their career. And I just want to share some of the feedback that they gave us as well. So Dr. Kreider, who actually was teaching the workshop at Hofstra and Zucker Hillside, where we were able to present Overshadowed, spoke to us about trying to get this into educational curricula for med students moving forward. So that's one of the key areas that we're trying to expand Overshadowed. We really just want to get, not only do we want to keep building on the content, we really want to expand the reach as well. So that was one of the really great things that we got out of that experience. And the last thing I really want to talk about is how we measured the impact of the project. The truth is, we knew we had to do a pre and a post survey, right? It was part of our requirements with the Office of Mental Health, but we really didn't know how well we were going to do in a 45-minute or an hour long conversation. So we were pleasantly surprised, actually. The survey we used only had 3 questions. We asked about whether the medical staff thought that a psychiatric diagnosis might make someone less comfortable seeking medical care. In the pre-survey, lots of people didn't quite get it. In the post, we were 100%, everyone agreed they could understand, given the experience, why some people might avoid going to the doctor at all. The second question was about whether they could think of some examples where having a mental health diagnosis resulted in some kind of treatment or medical issue being overlooked, that diagnostic overshadowing that we talked about. And in the post, everyone agreed, because that, ultimately that was really the strongest part of what we were trying to get across, that this can, not only is it not right or fair, like it can actually be dangerous. And the last question was about their own personal beliefs and attitudes, which is a little harder to look at, right? Because sometimes it's hard to look at ourselves. We still saw an increase here, not as much as the first two questions, but it was really great to speak to groups who were so open and so willing to have these conversations with us. So we're really grateful. And moving forward for Overshadowed, we want to continue to build on the content. And the biggest area there is we want to talk to people who have just sworn off doctors completely, because that's the other area that's dangerous. If we don't get primary care and preventative care, we're far more likely to develop these chronic illnesses. And I just want to share a very quick story that I think is very telling. We had one person who shared what I'll call a troubling story about, and it wasn't even in a hospital. Many of the worst issues actually were. It wasn't in a hospital. It was something he experienced with a primary care doctor. And I told him that actually would be really helpful for other doctors to hear about. Would you be willing to come and share that? And what he said is, I cannot appear on camera with that because I'm afraid my doctor will see it. Fear, actually. And I think it's important. That's a true story. And I think it's important for people to know that, because it's just an example of that power dynamic, right? And I think sometimes we forget that all of us, whether we have a psychiatric diagnosis or not, when we go to the doctor, there really is that power differential. And we just hope that the doctors can be aware of it, and we can start to bridge that, because ultimately we're just people, right? And stigma is about fear, and stigma is about misunderstanding. So we thank the Office of Mental Health, and we thank Behavioral Health News here for allowing us to do this project and to tell more people about it. Thanks.